Dr.
Hi.
Stella, how are you
Hi.
doing?
I'm good. How are you?
I'm good. Thank you so much for joining me tonight. I know
I'm
it's quite
so
early there
excited.
on the West Coast.
It's okay. It's 4 o'clock over here, so it's all good.
Oh
I'm
my
so
gosh.
excited.
I do have family that lives in the West Coast, and I'm so jealous of the weather there. I'm sick of New York and the snow.
That's okay. You come and visit us. We're
I know, I wish, I
open
wish.
arms. Yeah.
Doc, thank you so much for
You're
being here.
welcome.
We've been planning this for months, and can you believe it? Like, the time is finally here. Time is just passing by. It's just flying,
Right?
right?
I know. I mean, next thing you know, we're gonna blink. It's gonna be Thanksgiving, Christmas,
I know, I know. I
right?
think since the pandemic started, it's like the calendar is just flying by. If you could please introduce yourself first to everyone
Yes.
watching.
Hi, everybody. I'm Dr. Stella C. I'm a hospitalist here in the San Francisco Bay Area. So excited to be here today with Christian.
Yes. So I started this series because having worked through the pandemic in the hospital, and then the same day I would go out and there'll be people protesting like on the street saying, "Oh,
Yeah,
it's a hoax, it's a hoax." And then when the vaccine came out, and like there's so much misinformation going on in the world, especially in
yeah.
social media. In my mind, I was like, we have to bring in the actual experts to talk about these stuff. And I'm so grateful to have connected with doctors and clinicians like you, Doc. And you are one of those who really
Oh,
have been catapulting all this evidence based information to everyone, which are saving lives every single day. So thank you so much.
oh, you're
Okay.
welcome. It's been a pleasure. But you're doing a great job. I really am just so impressed by all the lives and the Q&A sessions. I wish I had when I was a med student. Can I just tell you? Or even when I was starting out. This is such an awesome resource.
Thank you so much.
Yeah,
And also, main reason why I wanted to do this is being also a student. I wanted to really introspect in the journeys of the physicians who are where they are now. And so if you
mhm.
could please tell us the long journey it took to get into this path of medicine.
Yeah, the long journey. So of course it was 4 years of college, 4 years of medical school. Undergrad was at UC Davis,
Mhm.
and then I did medical school at Western University in Southern California. And then I did my residency in San Francisco and St. Mary's. And then I did a year of chief residency, and then now working as a hospitalist.
And it's like you're a Cali girl. You are
I
a
am a
Cali
Cali girl.
girl.
I didn't leave California. It's true.
I know. I mean, I wouldn't too if I'm there already. I was so
Hmm.
curious if you have any inspirations to go into this path of medicine. Is there like parents, family, friends, a personal experience?
Yeah, my mom. I was raised by a single mom. My mom's a nurse.
Uh,
And I grew up in Guam, and she
mhm,
was, name it, she was an NICU nurse. She was a nurse in, mostly in the hospital. Then at one
mhm.
point, as they started getting older, we transitioned. She became the University of Guam's student health nurse. And
Wow.
so when I was about like 7, 8 years old, during the summers, I would actually go to the university with her at the clinic. And
Mhm.
the summer, I literally spent the summers there while I watched her administer PPD shots,
Yeah.
vaccinations,
Yeah.
clearance, all these people. There would be long lines of students who needed to get their clearances, and they had to go through my mom. She was the only nurse. My job was to literally be typing out their health cards. So if they cleared, I would be typing out health cards. So I got to do that. So I got to see firsthand what she did as a nurse, but also the internal medicine doctor used to come
Mhm.
in once a week to actually hold clinic. And
Wow.
I got to observe him firsthand at a very young age. I was 7 years, 8 years old, and
Mhm.
I was mesmerized because I was
Yeah.
like, wow, how
Yeah.
awesome. And it was just a different vibe. Love nurses, love my mom. It was kind of that thing, but it was like when the doctor, it was kind of a different vibe.
My mom too. She's a nurse, post anesthesia recovery room nurse now. She's been a nurse for 30 years as well. And so I remember also growing up, seeing her come home. She'd teach me stuff. And also now that I'm a nurse myself,
Mm-hmm.
which is not easy. I'm like, wow, this is what you went through the past years. And what's great is you were getting your clinical hours, doc, for application since you were young, right? You can have applied then already. And
It's so funny.
and that being said, still, it's like, of course, your childhood, seeing all this stuff, and then a decade long, more than a decade of training and education into
Mhm.
medicine. Truly a long, not so easy road. Do you have any regrets now that you've made it?
Regrets in going into the path of medicine? Absolutely not, because I knew I wanted to be a doctor
Mhm,
early
mhm,
on, right? I was 5 years old, watching
mhm,
my mom, watching that doctor.
mhm,
Absolutely, this is what I wanted to be. I think the biggest regret that I had was that I didn't really take the time to enjoy the journey. I didn't take the time to really kind of just slow down. I was so obsessed with,
mhm.
oh my God, I had to be at the top of this. I had to get the grades in this. I had to be here, but I didn't get to enjoy it. Like that, it was like the whole process was actually, if you look back, it actually was actually fun, crazy, hard, right? So much information,
Yeah,
studying all the time.
overload.
I wish I just like kind of slowed down and said, you know what? Maybe I studied enough for this test. I should go and kind of enjoy it and go hang out and really just continue the connection and the self-care,
Yeah.
which I didn't learn until later on. So that would be the biggest regret.
That's very helpful. As I know from your post as well, you're an attending physician, obviously, and you're also a medical officer, right? Medical chief, and take on the residents and teach them. Like I always say, I wish one day in the future you'll be my attending when I become a resident.
So sweet.
Having gone through the whole process, are you happy with how medicine played out in the current age?
I think pandemic was the biggest blinder. It took away a lot of the blinders. It became very, very apparent to me just how much the disparities are in the community, medicine. It played out. You see it firsthand. People don't have access, disparities. And the fact that, as you go along, you also see not only is it about race and about culture, it's also about gender too. Because being a woman in medicine, being a minority in medicine, you get to experience that firsthand. So yeah, no, it didn't actually turn out a lot of things that you kind of, the shocking reality.
Yeah, I actually wanted to delve into that. I've had so many women physicians on this live so far, and each one of them has always mentioned that there is a big disparity with women in medicine. Can you actually delve more into that, Doc? Was there a time that you really experienced that, wow, there is some sort of inequality just because I'm a woman? Just pursuing this male-dominated field in the beginning.
You should start off looking at opportunities that were available to women. I personally didn't have that experience where a lot of things that I wanted to go for, I was able to go ahead and pursue. But I did have colleagues who wanted to have that promotion or wanted that position and didn't get it. For me, my disparity has been more so just the day to day. For instance, if I were to go in a room with my residents and myself, automatically the term would be like, oh, so you're the doctor, and it may be, not disparaging at all to the med student, but because the med student was a male and I happened to be attending, it would be like, oh, so you're going to do the procedure, and you're like, no, I'm going to do the procedure, right? So it's kind of that thing. So I think that's on the day to day. I get to see that,
Yeah, and I see that firsthand too. If I go into a room with a female resident, they'll automatically think that I'm the doctor and that they're the nurse. It's great being a nurse, but truly there is that sense of, still I think it's a systematic and historical stereotype, right? That there can't really be women in medicine given that it's a male dominated field. But I'm so glad because I'm in a teaching hospital for work, and more than half of the resident program are women, which is great. We are seeing this new generation of empowered women who, I always say that it's not that they were never capable. The society never gave them the stage or the platform to actually realize, right, what they have capable of.
Or just the inherent biases because you kind of grew up that, right? At some point, it depends on what you were also used to. So you just had to kind of carry that on. So you'd have this expectation. You'd be like, oh, you're a woman. Must be a nurse.
Must have been a nurse, yes.
Kind of just kind of goes with it, yeah.
I agree. And yet, despite all of this systematic and system flaws, if there's one piece of advice that you would give to a student, either a high school student, a college student, or a current med student who really wants to pursue this field of being a physician, what would be that advice?
I think a lot of it is going to be believing in yourself and self-confidence in yourself because there's going to be so many people. It's such a hierarchical type of society that we're in, right? Because there's a pecking order for so many things. A lot of it is that you just have to trust yourself and know who you are and who you believe in, and most importantly, stand by it and assert yourself. Because a lot of times, if you're going to sit there and just allow things to happen around you, and you don't say, you know what, I want a chance. Give me a chance because I can do this. You might be passed by and no one will see you. So I say, stand up for what you believe in, fight for what you believe in, and definitely don't back down and give yourself the chance.
I agree. And I am so excited also for the next generation of medicine because we have amazing mentors like you. So thank you so much. It's July 1st. Interns come in. PGY1 to become PGY2 and so on. Please take me back to that time when you first entered as, oh, I am the doctor now. I am a resident. Please take us to what specialty you went into? And is there a motivation behind that? Was it the internist when you were growing up?
Yeah, internal medicine was definitely from the forefront, very much the choice beginning because of the other opportunities that you had,
Mm-hmm.
right? I wanted to go into internal medicine because of the fact you had the ability to learn so many complex diseases, get to also teach and educate and do and focus on prevention. But I love the fact that you had the flexibility. You could do inpatient, you can do outpatient. And then you also had the flexibility of taking on a fellowship afterwards, which at the time I actually was going to go into pursuing into going to cardiology as a fellowship. So that's the reason why, internal medicine was definitely the stepping stone going into it. That's exactly the reason why I wanted to go into internal medicine, because there's so much flexibility.
Yeah, and I agree with you, Doc, with the amount of information you have to know as an internal medicine physician. I guess you basically have to know it all. One of my close friends is an internal medicine resident right now at my hospital, and I just look at his notes, and during the rounds, I'm like, you have to know everything, do you? Like, you have to know everything. You got to consult this specialty, and it all roots back to the internal medicine doctor. And yet, despite all of those different consults, and of course, internal medicine is the whole body, what do you think is the bread and butter of internal medicine? Is there one or two or three things that you see the most every day that when you go in today, you'll be like, I'll see this again tomorrow? And then
there's like the top 5 for sure, right? Congestive heart failure, hands down. You're going to see some form of infection, pneumonia, sepsis, urinary tract infection. Number 3, heart attacks. 5, definitely, depending on what you're dividing into, strokes would be another one. And then your gastrointestinal bleeds. Those are your, these are your bread and butter. I would say those are your top 5 right there.
And I agree with that because all the time, I do work in a cardiac surgery step-down unit, but half of it is tele and regular med. And exactly those 5, those are like the top 5. And yet, despite those, do you still get excited when you go to work? I can just imagine the amount of adventure.
It is, because what's so amazing about it, right? Because as a hospitalist in internal medicine, they're not always just coming in for one thing. A lot of it is that complexity of okay, they have pneumonia, but now they also have a heart attack. And they might be in congestive heart failure. And they might even have a GI bleed, right? So you have all those things. So every day is a challenge. Everything every day is something new, and every patient is different. So it's always exciting.
And I think also the root of internal medicine is patient teaching. We see most of the top 5, if not almost all, are preventable with certain modifiable factors, right? Whether it's diet or exercise or checking your blood pressure and getting it under control, your sugar. So patient teaching is really such a key for internal medicine. So as the expert doc, what are the key ways to prevent these preventable diseases?
Yeah, I think along from the most important thing as a doctor, and then definitely we take the time to as hospitalists, is when we go in that room, is to really explain what's going on with the patient, right? Because if they really don't understand what's really going on, it's hard for them to predict. And then you go talk about all the modifiable things that there are possibly things that you can modify. So a lot of it is understanding what it actually is. And then also you have to involve the community, their families in part of that. Because being able for them to go home and continue whatever regimen or whatever you decided to do is also going to take part in what happens when they leave that hospital or that clinic. It's going to have to be, it's a whole community that has to come together to understand.
I feel like also a big factor of patient teaching, like you said, is the community, given that we have people from different socioeconomic status, right? It's not a one-size-fits-all. Certain things that might be viable for some people, the options may not be within the financial reach of other people, right? And other than that, there are patients who need more teaching than others, right? And how do you get to the heart of that? How do you actually really touch the heart of the person that they actually want to do something? Because I feel like sometimes because they're not motivated enough, but they actually want to change.
I think a lot of times is when you get to know the patient, I really like to dwell on their social aspect, whether you're going to connect with them because you're the same race, or maybe because you speak their language, or because they like the same sports team you have. I think making that connection is that huge, huge piece. And then trying to understand their understanding of what's going on. And then from there, you try to explain whether or not, what they believe is true or is it evidence-based, or what you can go ahead and augment and complement their understanding of it. I think that's the key, is how you're able to connect and just be able to take the time to explain to them. I think that's the huge part.
actually love one of the posts that you posted a few months ago where you were like, beyond the patient is an actual human, right? There is
Right.
a whole story behind that person. And it's great that there are physicians like you who are actually dwelling and delving into that. We always say there's no perfect system, there's no perfect nurse, no perfect doctor, but there are those who really connect with their patients on a really personal level. And I think that goes beyond even what type of training one person gets, right? And I wanted to go into this because you are a
Mm-hmm.
doctor of osteopathic medicine. And
Right.
all the doctors I've had so far trained under the allopathic medical school.
Mm-hmm.
So, as someone who has trained through it, what is the difference, Doc, between a DO or MD, if there are?
Sure, absolutely. And why don't we just go back a little bit to why I even went into osteopathic
Mhm,
medicine, right? So when I was about 9 years old, I was roller skating in my neighbor's front yard, and there was a hose, and I literally slipped on it, landed on my back. And then honestly, I was like, from that point on, I would go through major spasms where I was
mhm,
really hunchback because the spasms were so bad. And then even at a young age, it became a chronic problem. I developed chronic back problem. And the most easy thing that most people do when you go to the doctor, unfortunately, at that time was, okay, here's some ibuprofen and some ice, and here's that. And you kind of get frustrated because you're
mhm,
like, is that it?
mhm.
That's all I got. So the rest of my life, I'm just going to be living on this ibuprofen or
Yeah,
Tylenol.
yeah.
There's got to be something more. And what happened was I was a junior in undergrad at UC Davis, and I came upon my mentor, my future mentor, who was giving a talk about what is osteopathic
Mhm,
medicine. And basically, what I learned at that conference and still holds to this day is that we're talking about the viewpoint where they feel that the whole body has the innate ability to heal itself. The interconnectedness of all our organ systems and our systems in treating the patient all as a whole and a
mhm.
holistic view, the whole mind trend that in order to heal, you have to be able to tap into all of that so that you can get the person to heal back.
I agree.
And then you have that,
Mhm.
and then
Yeah.
you have the fact that they have the extra modalities.
I think it was last year where they merged the residencies for DOs and
Hmm.
MDs. At the end of the day, like it says physician on your ID card, right?
Right,
And I
right,
actually worked in a cardiac clinic all throughout nursing school. And the head doctor, Dr. Puma, not once did I know that he was a DO until I started nursing school.
right.
I started in nursing 4 years later. And yeah, despite all of that, all the training with the OMM, osteopathic manipulative movement,
Hmm.
right? And all of that interconnectedness and what DOs do with the body that you learn actually in school, right? That you train for in
Hmm.
school. Do you think that it has applications to modern day medicine?
Absolutely. So these osteopathic techniques are really meant to be hands-on diagnostic treatment tools that complement
Mhm.
what we're doing in modern day medicine, right? We're not saying that it replaces surgery, it doesn't replace drugs, it doesn't replace diagnostic, all the scientific things that we're able to do, but
Mhm.
they are modalities used. So for me, they allowed me to learn these techniques that I didn't have to rely on every single time with ibuprofen and ice.
Yeah.
I
Yeah.
got to do things that when my back goes out, I techniques are, my husband who was going with me the entire time he was with me when I was in medical school and going through all the training. So you end up having to learn some of those techniques. So in the days when my back goes out,
Yeah.
I'm like, can you help me, treat my back?
Yeah.
So some techniques that you learn and they really do work. So yeah, I do. I know a lot of doctors too, especially who are OBGYN, a lot of women who are going through labor and are having like bad cramping. They're actually out there in the labor, in the living room, actually trying to do some
Yeah.
techniques on
Yeah.
patients to kind of alleviate
Yeah.
their cramping and their pain back
Yeah.
there. So yeah.
And it's always great to have other modalities other than, just pharmacologic stuff because I believe there is such thing as fatigue when it comes to medications, right? We do have things like polypharmacy and I mean, I've been a patient before too, and it's just kind of tiring to hear the same recommendations over and over and over
Right.
again. That's how to build a relationship with the patients. And I know that you are so big on maintaining that connection with the patients. It brings forth a lot of memories with patients, right? Throughout all of your training, whether back in medical school or during clerkship or residency, or even now as attending, do you have a most memorable experience with the patient, whether it's most scary or most funny or most embarrassing, one that really sticks out to you the most?
Yeah, I did my ER rotation at the San
Mhm.
Francisco General Hospital, and there was this time where it was scary, and also one of those really memorable experiences where there was a woman who had experienced trauma where she had blunt trauma, had been stabbed because she said someone tried to break into her car. She was sleeping in it, and they were actually rustling in the car and actually duking it out. And then she had some blood stab wounds and she ended up in the ER. So I was one of the interns who was trying to help stabilize her. And then later on into the evening, so she was stabilized. She was waiting to get admitted in the room. The rooms were starting to get really crowded because it was trauma time. There's certain times in the ER, it's so funny, you can tell what's happening throughout the day because like the car accidents and when the bars close, that all kind of determines the influx of patients in the hospital. But a couple of hours later, there was this gentleman who had some lacerations on his hands and all that. And then my attorney said, "Oh, there's a patient with some lacerations in bed too. Can you go take care of their, lacerations?" So I love suturing. So I was like, yeah. So I was like talking to this guy and he said, "Okay, let's suture you up." Didn't really want to talk so much. And I was like, "Okay, that's fine." So when he was done, I kind of said, "You can sit out here in the main waiting area where some other patients were there." Short story is that earlier woman that I was taking care of wakes up and she turns and she looks across the hallway. She's all, "That's the guy who attacked me." Right? And the police just happened to be there because they're still investigating. He gets up, starts to run. Police yells. There's like four of them, goes, "Everybody down." So we're like now on the ground in the ER, just like basically going, "Oh my God, what is going on?" Because we don't know if he had like any weapons on him or anything. Because I didn't, not one of those questions. I was like, when I'm suturing, going, "Oh, so you have any weapons on you?" Yeah, it was not one of those. But yeah, that it was scary and it was memorable. That's like the biggest crazy story.
Oh my gosh, I can't imagine. And also, you're like an intern, right? It's your first
Right.
time.
You're
So I
like,
was like, oh my.
I don't know. Like you're like, yeah, it's like one of my first few weeks as an intern. And I goes, "Oh my God, I don't
God,
even know. Am I gonna survive this rotation?" Seriously. Yeah.
that is so
It was
traumatizing. I
crazy.
can't imagine. It's like something that you watch from like a medical TV show, right? It's like Grey's
It's so
Anatomy
true.
type of
It's so
episode.
true.
Oh my God.
It's
Oh
so
wow.
true.
But again, medicine, you always expect the unexpected, right? It's
Absolutely.
always. And I feel like that came true when the pandemic took over the world
Oh my
last
God.
year. So what happened was I started orientation on my unit. Beginning of December, I ended my orientation end of January, and we
Mm-hmm.
started hearing news of the pandemic in China, Japan, and Italy around February
Mm-hmm.
and around that time. And then our floor was converted to COVID like some weeks later. So I was fresh out of the gutter. I was just
Oh my
getting used to my
God.
cardiac floor
Oh no.
when COVID came in. We were transitioned into COVID ICU right away. My senior nurses who'd been working throughout different endemics were saying, "We have never seen anything like this." And Doc, you have been in the hospital for a while. And is it true that this is something that you have never seen anything like it before?
Absolutely. I've never been more scared, just absolutely floored. And, there are days where you just kind of had to take a moment where you don't even have time. You just want to actually take a corner and cry
Mhm.
sometimes.
Mhm.
I've been there in the very beginning where I've had a patient come in and they call us already as hospitalists because they're
Mhm.
like, "Okay, there's obviously a patient coming in really short of breath.
Mhm.
We're concerned about it. It's probably a patient with COVID, really low oxygen
Mhm.
saturation." And so we're already there, gowned up, ready
Mhm.
to go. We're working in parallel with the ER, trying to get things going. I've never seen people so sick. I mean, we're talking, they were like their oxygen saturated, like in this, like
Mhm.
maybe 68, 70. They're just gasping for air. They look like they're drowning.
Mhm.
And then, we go through it. It's been so devastating. You spent all that time. Everybody pours in everything they could to save somebody's life. And the amount of people that you lose and the amount of just the way people with COVID die because of the fact that they're isolated. You can't let families in. The fact that they're alone. I don't know how we're all trying to get through this,
Yeah.
and we're all just traumatized because it's
Mhm.
just unbelievable. The amount of death, the amount of suffering. It's unbelievable. It's nothing like anything I've ever thought I would ever have been trained for.
I agree with all those sentiments, Doc. Even until now, a year later, when I still talk to some of my friends who are not in the medical field and I try to recall some things, there's some things that I still don't want to say. Like, I just want to repress it at the back of my mind.
Mm-hmm.
And I still tear up. And there was one night where we had to bag 10 patients who died within 3 hours. Within 3 hours. I remember we were doing compressions on one patient in one room, and then we would run to the next room right after. It's not a big hospital, so there's only one code team, right? And I felt for all of the internal medicine residents and all of the anesthesia residents who are seeing all of this for like the first time. Even myself too. It was dark times. It was dark times. It's such an analogy, but I don't know if you're familiar with the Harry Potter series.
Mhm.
But there's like by the end it gets so dark, and there's just a time where everyone's like, everyone's like battling, so everyone's just so scared. I just
Yeah.
felt like, oh my gosh, this is the same sentiment. I'm just scared of what's gonna happen every single second. I didn't want to go to work. I was so scared because it's
Mhm.
not just, oh, I'm gonna marinate in 12 hours by the bedside, watching people pass away despite trying to help them, right? But what if I bring home something to my mom who's living at
Right.
home?
Oh my
What if
God,
I bring
yes.
something to our families, right? And I feel like that's something that the media didn't show beyond the depths, which of course we needed to amplify beyond the depths of the patient, beyond the lack of supplies in the beginning. It's the workers, the healthcare workers who were caught in the midst of the trenches. And I just wanted to ask from your perspective as an attending, as a medical officer, how did you feel for your students, for your residents who are going through? Imagine what kind of training that is, right?
So my heart goes out to all of them. I mean, it was just like, imagine it's already a scary time because
Yeah.
you feel like, they're going through the fact that they're just finally getting their clinicals in, they're now
Yeah.
becoming responsible for all this.
Yeah.
And it was just chaos.
Yeah.
That's what's the
Mhm.
sad part of it, is because you couldn't really sit there by their side and
Mhm.
give them the guidance that they
Mhm.
needed,
Mhm.
because everybody was kind of fight or flight at
There's
this
no
point.
time to learn. Yeah.
Because there's no time, because you
Yeah.
were just like, oh my God, we
Yeah.
got to there's a code going on. We all got to go
Yeah.
run over there now, right? And
Yeah.
got to do this. So that's what I felt so bad. It's just that we kind of had moments where we could just like sit down and say, how are you doing?
Yeah.
Are you okay? Do you have any questions? Can I
Mhm.
help you?
Mhm.
Because you're like, at the same time, you're thinking the same thing about yourself. How are you? Are you still okay? Because we were just all just running around, like literally one from one thing to the next. And it was just chaos and just devastation, one after the other.
Yeah, we had a 30-year-old patient come in, no past medical history. Came from the ICU, was an ECMO, all of that stuff. Came to our floor, was stabilized. Went through a code and unsuccessful code. 32 years old. And one of the residents who I was alternating compressions with was the same age.
Oh my God.
After the code, and we were wrapping up the body, and we had to take out the intubation kits, right, out of through the mouth. The resident and I just hugged each other crying after that code. And I felt so. Nursing school and medical school don't prepare you for this no preparation for these kind of stuff. And it was really dark times. And yes, we gained light, right, when the vaccines came in. And despite all the misinformation that we battle daily about this amazing scientific advancement. But as a hospitalist, you are the first-hand witness. You are the chief. What did happen in the hospital when vaccines started rolling out? Was there a difference? Did it help?
I think everybody will let out a collective sigh of relief.
Mm.
That feeling that, oh my gosh, that maybe this might be the beginning of the end. Maybe the feeling of, I feel a little bit more secure. Just for me, from my standpoint, it was like every day was down and up, and you were scared to death,
Yeah.
right? Right?
Yeah.
You go in there and you're like, do I have it enough?
Yeah.
I mean, I literally have to like ask my coworker and be like, okay, after 7 layers or whatever how many layers I am, do I look like I'm missing anything? Because I'm about to go in here right
Yeah.
now. And it's just that this constant paranoia that you don't have enough. And God knows we talk about what happened in the beginning where there's not enough,
Mhm.
right?
Yeah.
And it was literal chaos, especially in the beginning part when we were all trying to figure out what was the guidance, what should we be wearing,
Mhm.
should you have a mask,
Mhm.
should it be N95? I mean, it was just like the chaos. And then no, maybe we don't have enough, and
Yeah.
you guys need to like kind of just keep
Yeah.
holding on to your mask and
Yeah.
hope it doesn't fall apart.
Mm-hmm.
Yeah,
Mm-hmm. Yeah, I remember those days where we had to reuse the same N95 for days,
yeah,
right? Because we didn't have enough.
right,
The whole nation was struggling with PPE
right.
supplies. And yes, protocols were changing. The guidelines were changing all the time. Oh, you don't need the mask. Oh, yes, you do need a mask now.
Right.
So I feel like it was, I mean, it's a novel virus. No one knew what to do.
No one knew.
And it was hard for us who were in the epicenter of it all, right? I
Right.
know there was a time in California, well, we had the spike like early April, and it was so bad. And then I know California followed months after. How was that mental health wise? Because I know for me, there were nights where I'm like, did I choose the right field? Is this
Oh yeah.
is it
Oh,
okay to
absolutely.
quit while it's early on and find
Right.
something else? How was that for you, dog?
No, it was. Now we would collectively hear at the end of the shift, like we were like see each other by the car, and we all looked at each other and we're like, "Is it too late to like turn it all in?"
Yeah, yeah,
Right?
yeah.
Because it was so overwhelming. We were exhausted, and we're all exhausted mentally, physically, emotionally, because we spent the day like crying and trying to keep it together. I mean, it was just so much.
Mhm.
I mean, I'm still scared to death
Yeah,
because I don't know where we are right now.
yeah, yeah.
And the thought that we're gonna possibly go through another surge or what all
The
this
Delta
because of
variant.
what's happening right
Yeah.
now is like I don't know how much anyone has left to get. I know physically no nurses who've given notice and said, you know what, I'm done.
Yeah, yeah,
I'm done.
yeah.
I feel like I have nothing more, much more to give. And it's been a year and a half.
The shortage is real. Nurses, physicians, respiratory therapists. Thank God for respiratory therapists
Oh my
all
God.
throughout all of this.
Right.
I always say the unsung heroes of the pandemic, respiratory therapists, the hospital environmental team who cleaned each
Yes.
room,
Oh my gosh.
blood splattered
Ladies
everywhere.
and gentlemen, let me just tell you, they have to go in there no matter what the condition of that room looks like.
Mhm,
After all the procedures
mhm,
and the codes
mhm,
and whatnot, these poor people go in there and they are cleaning
mhm.
head to toe that room and they are exposed.
Yes,
They are exposed.
yes,
And absolutely.
yes.
I was so happy because the day that I got my vaccination, I was next to one of the members of the environmental team, and I was like saying,
Yeah,
"Thank
thank
God
you.
you're
Yeah,
getting your
yeah,
vaccine."
yeah. Despite all of the unclear aspects and the dark and the fogginess of this whole pandemic, I think it really showed how imperative teamwork was amidst all the interdisciplinary teams. And I think all of us need therapy after what we all
No, we are.
through.
There we
And-
are.
yeah, and I wanted to ask Doc, now that we've heard news of Delta variants, it's real, it's viable, it's tangible. New York cases
Mhm.
are rising again. How is it
Mhm.
looking like in California right now?
It is. It's rising as well. So we have pockets. I know Southern California looks like it's even more so. It's kind of driving the numbers, but I'm actually seeing it too because I've got friends in different hospitals across the bay,
Mhm.
and they're telling me, yeah, they're seeing pickup in terms of the uptick of hospitalization. And well, you know what's even more sad is the fact that some of them are a lot more children. They're younger now.
Yeah,
And that's what's really disturbing and that's really sad and heartbreaking.
yeah. Let's just let it out to everybody. COVID-19 is mostly a preventable disease.
Every
Yeah,
hospitalization,
yeah,
every death. And that's what makes it heartbreaking
yeah.
because it is preventable.
Yeah. And Doc, having seen it all and through the waves last year and this year, vaccination, Delta variant, if there's one piece of, I wouldn't even call it advice, what is the one thing you would like to say to the world about everything that you have seen about COVID-19?
First of all, that it's real. First of all, we are the same providers that you all run to when you have a heart attack or a stroke or a ruptured appendix. You trust us enough to come in for us to take care of you. We are the same people who are telling you COVID is real. We're the same people who are telling you that the vaccines are effective and that they work. They're not 100%, but they're the main thing and the reason they were created is to prevent severe disease, to prevent people from dying on a ventilator, people from dying, period. Help yourselves, protect your families. There's so many people in the community who can't even get the vaccine. People who are clamoring to get it if they could.
Mhm,
People around the world
mhm,
who are clamoring to
mhm,
get it,
mhm.
to have the kind of vaccines that we are so
Yeah,
privileged
yeah,
to have,
yeah.
especially there's no reason we need to lose any more lives. That's the ultimate message. We don't have to have people dying anymore.
It was beautiful, Doc. And just let it out to everyone, there's no 100% in medicine. That 95% efficacy, that effectiveness, that is what we need to safeguard, not just for ourselves, for our loved ones, but for our community.
Right.
That's what we need. That is the crux of herd immunity, is that we get almost as much as we can protected. And I agree with you what you said, Doc, earlier, that I don't know if any healthcare workers who worked through the pandemic has enough, has remaining strength to bypass another big lockdown, another big battle against this. And I actually wanted to segue into the what you advocate so much about, which I really appreciate, is the concept of self-care. It's very sad because I feel like nowadays people view self-care as a luxury when it should be a human right. It's an
Right.
innate thing that we should be always veering towards self-care. And even beyond before the pandemic, Doc, how did you decompress out of work? Medicine, being a physician is not an easy job. People's lives are on you. You make the executive decisions. You take the calls on people's lives. How did you decompress out of work?
I
Either
had
even
to.
yeah.
Right. So coming home, whether it was, hiking, biking, dancing,
Mhm.
playing the piano, anything that brought me joy and happiness, I ran to because it had to be. It was important for me in terms of my relationship with other people. It was important for my relationship with my patients.
Mhm.
And it was most importantly, it was important for myself because talk about going to a dark place, right? Because you just get to the point where it's always constantly dark. If you didn't find those things that brought you joy and happiness, I mean, third mornings it's hard to wake up and get out of bed. And so, we had to do something to help ourselves because if we don't, I mean, we needed something that was going to be long lasting
Mhm.
to be able to keep building our resilience and giving us motivation and inspiration to wake up and go back and do what we have to do.
Beautiful, dog. Every time I see a self-care post from you, I'm like, yes, 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 amen. Because I feel like the system has somewhat inculcated in our minds that we should just settle when we shouldn't.
Yeah.
Like mental health care is self-care. And I feel like also within the academic sphere, I think one of the things in self-care that people try to run after also is the concept of imposter syndrome.
Mm-hmm.
Do you still experience that, Doc, after all the successes and achievements you have had in the field of medicine?
Of course, right? We're human. I have to say though, however, it does get better as we get older, as we become more experienced and we become more self-confident in ourselves. The imposter syndrome gets definitely lessens. I don't say it goes away completely because you could let me go back to a medical conference and be in front of all these amazing people, and I'm like, am I supposed to be here? Who am I? Yeah, it creeps in. But then you second you remember, you know what? You remember, yeah, I did work hard for this. I earned it. I did educate myself for this. So I should be here, right? So I think it's kind of there's this moment when you kind of turn it off and you're like, yeah, but you know what? It's okay.
It's amazing, Doc, and you deserve all of it. You deserve it all, Doc. You are such a great person. You are. I always tell my friends, "Oh, Dr. Stella, I'm gonna have her on Saturday." She is like the most maternal and nurturing person ever. Thank you so much for always being so loving and supportive, and thank you so much for gracing me with your time and your presence tonight. I have been so excited for this. I can't believe it finally happened.
I was so too.
Thank you
I
so
was so too. I am
much.
so happy too. It's my pleasure. You know that it's been a joy. Just I'm so happy that we connected. You're just like, so easy to talk to. I just feel like I feel like I've known you for years, and we can just sit down and just like talk about
Thank you,
anything.
Doc.
So I love it. So
And I think that
absolutely, it's
and
been
I
a
think
joy.
also that's what the lockdowns have also been great. It's like, yes, isolation, stay at home, but the connectivity through
Mm-hmm.
all of these people in the medical
Mm-hmm.
field, through Instagram, through TikTok. I just have to say that TikTok have been such a great vessel for people to be educated. It's
I
amazing.
think so.
It's
I
so
think so.
amazing what social media could do, right, Doc?
Right.
And actually,
It is.
my last questions for you is how do you balance that social media and medicine? Is there a line of delineation for you, or we just mesh it together and actually this is the new generation of medicine?
It's funny because I think it really is. Like, there's at some point that it just becomes part of you. It's funny. I'll be resting out, I'll be working out, and then an idea comes on, and you're like, oh yeah, I'm gonna make a
Yeah,
TikTok or a
yeah,
video about
yeah,
this
yeah,
because the inspiration just comes on.
yeah.
But it is powerful. 15 seconds to a minute, and you can come out here and just give such helpful information that it's digestible and for people to remember
Yeah,
and it's entertaining.
yeah,
It's powerful.
yeah.
Absolutely.
And your patient education goes beyond the hospital, beyond the four walls of the clinic. It's all over the world, which is such a great thing.
Yeah.
And one of those
Yeah.
people that has been
Yeah.
reached was me. So, Dr. Stella, thank you so much for your time.
You're
It has been
welcome.
such a pleasure. The honor is all mine. Thank you so
Oh,
much. I'm so
stop
humbled.
that. It's my honor as well.
No, no, no.
If I
Thank
could
you.
give you a hug, I would give you a hug. So
Virtual
virtual
hug, Doc.
hug.
When I visit California, I will let you know.
you.
Dr. So have a good night there and stay safe always.
Yes.
Thank you so much. Bye
Stay safe,
everyone.
everybody.
Thank you.
Bye.
Bye.